I'm Dr. Saeeda Haider, Professor and Chair, Department of Anesthesia at the Indus Hospital, Karachi, which is part of the Indus Hospital and Health Network. Today, I want to convince you to choose anesthesia as a specialty. Why choose anesthesia? So I'm addressing really the fresh medical graduates and any doctor who wants to choose a specialty after doing their MBBS or a little later in their life. I would say anesthesia, also known as perioperative physician today. So why talk about it at all? Let's elucidate why. It is because you as an undergrad has never been exposed to anesthesia. It is not part of our curriculum at the undergrad level. I have been there and I didn't know anything about anesthesia till I joined it. And another solid reason that I have to say that is that I'm running a robust residency program at the Indus Hospital, and I take interviews of the candidates who come in biannually, every 6 months. And my favorite question to them is to ask them, why do you want to do anesthesia? And usually the answer used to be vague. It used to be, as a last shot, we don't know what else to choose, etc. However, things have changed now. After the COVID, in the COVID unit, they have been posted as MOs, and now they come and they say, ma'am, I was posted in as an MO in the COVID unit, and every time the patient crashed or had some emergency, everybody just pulled back and they made a phone call to someone who was an anesthesiologist, and he came there to put an invasive line or endotracheal intubation or to hook the patient to the ventilator, and he was the problem solver. He was the life savior, and I want to be that as well. And that's one of the reasons I'll give you to choose anesthesia. The knowledge and skill of an anesthetist is it relates to the practical application of clinical physiology, pharmacology, medical and surgery altogether. So this is one of a very big enough reason for you to join anesthesia. There are many other reasons as well. The scope of the field, the scope for you as a breadwinner for your family. It's a highly paid, eagerly sought, both nationally and internationally. The day you have your degree in your hand, you become worth lakhs, not just locally, but in Middle East, in UK, in Ireland. I love working in Pakistan and I love doing anesthesia. However, it's my passion. It's really my passion, both living in Pakistan and anesthesia. But if you want to go abroad, settle abroad, anesthesia is a big chance. They come looking for anesthetists everywhere. Another very good reason is that it has an expanding domain. Anesthesiologists today can choose a subspecialty. There are subspecialties like pediatric anesthesia, obstetric anesthesia, neurosurgical anesthesia, cardiothoracic anesthesia. You can become a pain medicine specialist treating chronic pain of cancer patients or non-cancer patients. Critical care specialists. Today, all the intensive care units are headed by anesthesiologists. Emergency services, they're best trained to do CPR, the ABC of medicine. We have even sort of got into the medical specialties because there are a lot of minimally invasive surgeries that have been taken up by the medical specialists in the endoscopy suites, in the CT, MRI, ultrasound guided procedures, and they require anesthesia. So you are part of the medical fields as well. And then essentially the peri-op care of a surgical patient. You are not somebody who just goes and puts the patients to sleep and walks away and then come back and wakes him up. You are somebody who's involved with patient care from the preoperative period. In the preoperative period, you do the assessment, you do the optimization, the management, and then in the intra-op, the patient is totally under your care. The surgeon is doing his surgery while you are looking after his cardiovascular system, his respiratory system, his blood loss, replacement, fluid intake, urine output. Literally, you're looking after the whole patient in the intra-op period. In the OR, it's really a teamwork. And you know what? The anesthetist is the team lead. He's the captain of the ship there. If something happens, if a crash happens, everybody just holds back and the anesthetist takes over. And then there is continuum of care in the post-op period, in the ICU or even on the floor, managing pain, fluid replacement, etc. There is, of course, a flip side to anesthesia, and that is the reason why most people sort of are worried, because you are in the background. You are in the background because the patient comes to the primary consultant, who is either a surgeon or a physician. And the second thing is there is a lack of public awareness of the role the anesthesiologist plays. They don't know when they are handing over their patient in the theater or in the critical care. Now, anesthesia has a flip side to it, and that really overwhelms doctors, however unnecessarily, really. The patient never comes to you and goes to the primary physician or surgeon, and you are in the background. So you get discouraged that nobody knows me. And secondly, there's lack of public awareness of the role of anesthesiologists. They don't know that they're handing over their patient to their loved one to the anesthesiologist. The thing is, the surgeon who's going to look after the patient during surgery. However, it is a teamwork in the OR, and it is the team lead is really an anesthesiologist. Thirdly, there's a dearth of highly qualified medical anesthesiologists, and the only way to get by all this is to have lots and lots of good anesthesiologists who work with responsibility and excellence and pass on this knowledge, train and teach the future generations. Everyone has a right to a better life, and so do you, the fresh medical graduate, or you who are choosing a new specialty. Good earning and better standard of life, ethical practice and good patient care, greener pastures abroad in Middle East, UK or Ireland, professional growth, they're all there waiting for you. So go